Hi everyone, Josh Longest, Ardmore insurance guy here. Appreciate you watching this video. It's going to be about Medicare Advantage. We're going to go over it real quick. Start out with pros, and we'll go over to the cons. How about that? Upfront cost is the main pro of these plans. $0 monthly premium for these. They give you additional benefits not included with original Medicare, like gym memberships, prescription drug coverage, over-the-counter benefits. So basically anything you can think of at a pharmacy, like toothpaste, toothbrushes, aspirin, vitamins, things like that. A lot of stuff like that is covered with that over-the-counter benefit. They just give you a certain amount every 3 months or so for you to go in and kind of stock up on those things. Helps a lot of people. And then dental, vision, hearing, you see this DVH. So original Medicare doesn't cover any dental, vision, or hearing coverage. And then the big one, I would say, maybe even more important than the upfront cost is $0. You see it says MOOP, and that's max out of pocket. So remember, with original Medicare, you're basically on the hook for 20% of all your hospital doctor bills. Medicare takes care of 80%, you got to pay the 20%. So if you have a $100,000 hospital bill, you're going to be paying, I don't know if you're going to pay it, but you're going to be responsible for $20,000. And this gives you protection against that. Typically the max out of pockets in our county, Carter County here, is anywhere between, I would say, $4,000 up to $6,700. So, and I know $6,700 is a lot of money, but it's less than $20,000. So there you go. The cons of a Medicare Advantage plan. The first one are copays. So anytime you go to the hospital, you're gonna have copays, ambulance ride, copays, doctors. Typically your primary care doctor is $0, but any specialist that you go see is anywhere between 30 and 50 bucks every time you go to a specialist. Hospitals, even more than that, like 200 to 400. Those are typically what hospital copays are on Medicare Advantage plans. We do have hospital indemnity plans that you can put on anywhere from 40 to 100 bucks a month that will usually fill in the gaps of those huge hospital ambulance copays, and even cancer. If anyone's ever been affected by cancer, then you know the treatments are extremely expensive. You can throw a hospital indemnity policy with a cancer rider on, and it will beef up this coverage a lot. So the number 2 con is network based. So it's important to work with a local agent that can look up your doctors, your pharmacy, and make sure that you're happy with that network. I've heard of one situation where a certain company, a doctor in our area, decided not to take this company anymore. The guy was on a restrictive HMO, which is basically if you're not in the network, they won't see you. That's exactly what happened. He went to the doctor, they said, we don't take that, sorry. He had to go find a new primary care doctor. So if that's happened to you, you need help, call me, I can help you. But what I would do is, what they should have done with this person is say, okay, who's your primary care doctor, who are your specialists, run them through the system, make sure it fits whatever company you're looking at. The last one, pre-authorizations. You can Google that, do some research. It's typically how health insurance companies manage costs. It's also how you can get that upfront cost of $0 a month premium. So and a lot of people don't like it because with original Medicare and with Medicare supplement, pretty much you have your Medicare card, give it to them, whatever the doctor wants to do, it's done. With Medicare Advantage, it's more like traditional insurance that most people have had with their group plan through work. They'll do the pre-authorizations, they'll check with the insurance company before they do anything super expensive to make sure that they approve it, and then they go from there. So a lot of people don't like that, but it's just part of a Medicare Advantage plan. So anyway, if you have questions about Medicare Advantage, again, this is for a lot of times what I see is people that are looking at Medicare supplement, can't necessarily afford it. They'll look at the Medicare Advantage plan because they know even if they have the best beefed up coverage on Medicare Advantage, you can pay, like I said, at most $100 a month for these indemnity policies that kind of fill in the gaps. You can have really good coverage for $100 a month. But then some people just like the peace of mind knowing that even if they paid up front and never use it, they know if they ever go to the hospital with a Medicare supplement, like from the previous video, they know those hospital bills will be, for the most part, taken care of. So that's kind of what we talk about whenever you come meet with me or we talk on the phone. We kind of figure out where you fall, where you want, what's your strategy? Do you want to do Medicare supplement, so where you just pay it all up front, you're taken care of, kind of have peace of mind? Or if you want to try to save a little bit of money, we'd look at a Medicare Advantage plan, and it can work for almost any. One size does not fit all in these. I hear a lot of people that are like, no, I'll never talk about a Medicare Advantage, it's terrible. My baby cousin's sister told me that it's whatever. It's not the case. If you have an agent working with you, explaining it, showing you how it works, you can have very good health insurance with a Medicare Advantage plan. So don't let anybody scare you. I can help you with Medicare supplement or Medicare Advantage, but I'd like everyone to at least know their options, and I don't want misinformation to make people think, well, I'll never do that because they told me it's whatever they told you. I don't know, but you can find a good option either way, no matter what your budget is, and that's my job, is to help you. So call me if you'd like to talk, 580-220-0808. Have a good day.